From Croaky here at the Safer Care Victoria annual conference here in Melbourne, and we've just had a little session basically on From Little Things Big Things Grow, really. I think I would like two of the presenters to introduce themselves right now. Thanks.
Thanks. It's Lois O'Callaghan from Mallee Health and Community Service.
Welcome.
And I'm Denise Fitzpatrick, Regional Clinical Governance Coordinator from the Grampians region in Ballarat.
So very nice to have some rural and regional voices here, and there are many here today, I think. So both of you gave examples of cut through, really. So who would like to go first?
Lois.
Thanks, Denise.
Over to you.
Lois, tell us about your pony.
So my pony. So the pony that Marie talks about is, so we've been doing work in our rural community up in the northwest of Victoria, up at Oyen, around how we engage our critical friends or important friends in our community. So I focused on an important issue in rural communities, and that's around volunteers. And how we use volunteers to the best and maximum effect in our community. What we see in our community is that people want to volunteer, but we have to be very careful about how we use that resource.
Because you have extraordinary rates, but
yes.
Therefore
the
risk of fatigue.
Yes, that's right. So we have the statewide average for volunteering is 6%. In our community, we have the privilege of 47%. But that comes at an absolute cost. You know, it means we have to use our resource very carefully. It means that we are at risk of volunteer fatigue. So we've just thought about, and I've talked today about some creative ways, other than using the usual methods of a community advisory committee. I've talked about other ways that we've captured that for the purposes of demonstrating, for the purposes of accreditation, how we meet the standards.
And it worked. You met the standards by doing what?
By riding a pony. So what we actually decided to do was we actually made some deliberate decisions about not having a consumer advisory committee, but capturing the ways that we did interface with the community and the methods that we did interface with the community with. A community who's very much built our health service, literally, with bricks and mortar over the years, and who are very engaged in lots of different ways in our health service. So we've looked as a health service about how we document the ways that we talk to consumers, you know, whether that be pop-up focus groups or community groups, whether it be through resident meetings, whether it be through our parent advisory group committee meetings at our local kindergarten, those kind of things, thinking about not duplicating what it is that we do. So working a little bit smarter rather than harder.
Fantastic, Lois. Thank you very much. And now, Denise, you went on a road trip.
We went on
Without
a road
pony.
trip. No pony, but we did take a vehicle that met all the standards. But what we did was, our road trip was the Victorian Clinical Governance Framework, and we went around this is the quality and safety personnel from the Grampians region, from each health service. We went around the region and we looked at clinical governance capability. And what we did was built a little bit of a profile across the region of what clinical governance capability was looking like, and looked for some gold and what we might be able to scale, and what were some of the potholes in terms of things that we might need to work on as a region to improve. Because for best care, you need care that's safe, effective, personal and connected, and so we looked at all the ways that we might be able to build that.
And what were some of the standout examples?
Oh, we had
Many.
lots of standouts. So I really loved Belinda Scott at Bacchus Marsh. She headed off down to Vinnie's to spread some healthy gossip. And, you know, on the back of Bacchus Marsh, it was really heartwarming.
Tell us why that is for people who aren't from Victoria.
So Bacchus Marsh had some neonatal deaths that were preventable. And that gave rise to the Targeting Zero report, which gave rise to Safer Care Victoria, which is why we're here.
Well put.
And so, as a consequence, their communities really suffered over the time, and their numbers of women going there to deliver dropped off substantially. And so, as they rebuilt, they needed to spread some healthy gossip to say, things are going okay here. There was also an incredible aged care facility in Warwick-Nabil that had been co-designed with the community. There was incredible community partnerships in Nil with the Karen refugee community and also out at Eden Hope. They were just doing really novel things with the local sporting communities, with men's health, suicide prevention, just numerous numerous amazing things with communities, because as Lois said, communities just run these smaller health services. They're fantastic.
And is there somewhere people can read about that?
We haven't published it. We did start to do some research on it, but it was more about the methodology. But I guess it is something that we probably should be writing up and just discussing what we've done and what we've found.
Great. Thank you both very much for that whirlwind trip through your presentations. Any other comments you wanted to make?
No, just thanks for the opportunity.
It's been great to have an opportunity, but I think it's been what's been good about the conference today is the celebration of what we do well.
Yes.
I think that's really important. We often, unfortunately, in the health sector, we come under a lot of scrutiny quite quickly for things that don't go quite well. And yet there's many, many things that go right.
Yes.
So it's been a delight to be here today and to celebrate what's gone right as well.
And I think we sort of linked in really well with the earlier speakers, with what Ewan said earlier, and also with Helen Bevan's transformation talk. So.
Which we're learning from success.
Yes.
Yeah. Thank you both very much.